Well, let's come back to what was going on in the campaign today. Let's start with a policy focus. That NDP promise of the help for the sandwich generation is the latest pledge of help for families dealing with increasing financial pressures. More and more families are in that sandwich, caught in the middle of raising small children and caring for elderly parents. For more on that, I spoke earlier this evening with two people who know the issue well. Here in Ottawa, I'm joined by Dave Quist from the Institute of Marriage and Family Canada, and from Toronto by Susan Eng, the Vice President of Advocacy for CARP, the Canadian Association of Retired Persons. Thank you both for joining me today to talk about this. Susan Eng, let me begin with you. How big is the sandwich generation in this country? How many parents are busy looking after young children and are also the primary caregivers for aging parents at the same time?
Well, in fact, we can answer that for you. Statistics Canada did a recent report that identifies some 2.7 million Canadians are in exactly that position. And they did that to focus in on the fact that there are so many Canadians that are, in fact, looking after their loved ones and still have children at home.
Dave Quist, what kind of stress does this kind of situation put on a family?
There's an enormous stress on this, actually. There's the stress of your own job, if you have one, or caring for your own home, just the day-to-day duties of that. There's the stress of taking care of your children, getting them to school, or they might be preschool children, or whatever it might be. And then there's the added stress as your parents age, and the load on top of that, health concerns. If they are no longer mobile, you need to be taking them to appointments and things like that, which always increase with age as well. So there's no part of your life that doesn't have an additional stress load on it.
All right. Susan, let's look at, well, both of you, let's look at what's on offer from some of the political parties in this campaign so far. Let's start with the New Democrats. They're out today with a proposal to provide forgivable loans for half the cost of construction for an addition or an apartment in a family home, so a family could take in an aging relative. What do you think of that approach?
Well, it's a very good one. It's new. And I think that the important thing to remember is that caregivers are mentioned at all in this election campaign. For the longest time, organizations like ours have been trying to get the politicians' attention to the very critical issue. And so the fact that the three parties are in fact bringing forward their platforms and debating with each other around a very issue that's central to our lives is already important by itself. So there's a recognition here, there's a need to support family caregivers, either with support in terms of tax credits or in terms of helping them set up their homes to look after their loved one. So all of this is to the good. Obviously, we're going to spend some time looking at what is effectively on the table to see if it's enough.
Dave?
I agree with Susan. The idea that we're well into the second week of the campaign, we're talking about social policy at this time, is a very good thing. To talk about caregivers in what we often think of demographic shifts as being our children and a declining birth rate. In fact, the growing need demographically is our seniors and seniors' care. And so to be talking about it with our three major parties in this country, one of the lead two parties, the Conservatives or the Liberals, will be the government of the day, is a very good thing. We need to be looking at that, analyzing that, and saying, how can we best meet the seniors' needs, not just today and tomorrow, but for the next 20 and 30 years?
Now, what one of the key changes we're hearing from both the Liberals and the New Democrats is this, proposal to give someone caring for an elderly relative 6 months of employment insurance benefits if they need to take leave, and that's up from the 6 weeks of compassionate leave that's currently allowed. But there's a lot of talk about around the cost of having to do that. So, Susan Eng, place that in some sort of context for us, the cost of allowing this extended leave and the cost of not allowing the extended leave.
Well, exactly. The point is, what would you do instead if you didn't do this? If a family member did not take time off work in order to look after the loved one, that person would probably go into care. And that costs the system lots more, never mind the fact that you have better health outcomes if they're looked after by their family. And so I think that's the way you have to look at it. In addition, there has been a quantification, an estimate of how much family caregivers provide to the system as it is with their unpaid labor, and it's been estimated in the neighborhood of $25 billion. And so that's the kind of money that is being contributed by people. So what is the cost now of providing the additional leave so that they can actually take time off work to look after a loved one, I think you have to compare it in that fashion to see whether it's worthwhile to spend this kind of money.
Should this, the Liberal plan, I didn't hear a cost from the NDP plan today, Dave Quist, but the Liberal plan is $1 billion they're talking about. Should we be having a conversation around the cost, or is this a measure that the country can't afford to do without any longer?
We can't afford to not have that conversation to start with. It's not going to be a cheap program, but as Susan points out, it is cheaper to keep our parents, our elders, our loved ones within our homes, if at all possible, for several reasons. It's cheaper, they have better care at home, and also the infrastructure on the short-term and the long-term care for them is simply the infrastructure doesn't exist within this country right now. Our society is aging. Most of those homes are already filled up to capacity with long waiting lists, and so there's a lag behind on the infrastructure to support this program or to support seniors in the long term as well, and we can do better at home with better health care.
Well, I guess the issue then, Susan Eng, is that it's being, as you say, talked about in this campaign, but what's the urgency to actually have some movement on this?
Well, of course, we worry always that an election promise doesn't turn into reality. And obviously, as an advocacy organization, we'll be watching very carefully what happens after the election. In the meantime, we're gauging to see what the promises that are on offer are going to amount to. And we looked at the federal budget, for example. We've looked at the different platforms. And they are all advances on the status quo. There's no question. The question is whether if it's going to be enough to help people.
Dave Quist?
We do need to be looking at those things. We need to be looking at registered nurses and practical nurses with a gerontology perspective. We need more doctors that are having an emphasis in gerontology as well. But we also need a care program that comes out to our homes as well, which exists in some provinces, but it needs to be expanded and grown upon. This is going to be the biggest growing factor within our healthcare system over the long term right now.
All right. On that note, I want to thank you both for taking time to speak with me about this today, an important issue, and we'll see what happens when the election campaign's over and there's a government in office. We'll see what happens with these promises, but thanks for your time today.
Thank you.
Thank you.